partnership grants. Oh, Katie, thank you for hitting the record button.
No problem. I didn't want to interrupt you.
Saw that now. We did hold one pre-bid call so far. There was a lot of questions from that call that we were not able to answer, that we came back with. If you have not seen it, on our website, I will put the link in the chat. On our website, we posted a response to some of those questions, and then to help with some of the additional questions, most of them were surrounding budget. As most of you are aware, I sent out an email, I think it was yesterday or the day before. There is a new budget template from the CHRC. So we have Amy and Lorianne from the CHRC with us today to help with any of those questions, since it is a new budget template. So I guess we'll do just a quick round of Midshore introductions so you guys know who you're talking to. Sorry, I'm Taylor Garrett. I'm the hub manager here at Midshore. Katie?
Hi, good afternoon, everyone. It's great to have such a nice group here this afternoon, all this interest in our partners. So I'm Katie Dilley. I'm the Chief Executive Officer at Midshore Behavioral Health. And I do want to extend my gratitude for representation this afternoon from the consortium being here joining us. We really appreciate your leadership and being a partner in this process. So just looking forward to trying to help out as much as we can to move this forward, and looking forward to the discussion. So thank you. And I'll pass it to Tim.
Hey, good afternoon. I'm Tim Wright. I'm the Chief Financial Officer with Midshore Behavioral Health. It's good to see everybody this afternoon. Looking forward to working with you all. Bridget, you're up.
Hi, thank you. Hi, I'm Bridget Keeley. I'm a Programs Director here at Midshore. It's great to see everyone. And I'm going to pass it to Rachel.
Hi, everybody. I'm Rachel Stoyanov. I'm your hub liaison from Midshore Behavioral Health. I'm Taylor's right-hand gal, and I'm just so delighted that you're all here. I look forward to working with you. And Trish?
Hi, everybody. Trish Todd. I'm the Data and Quality Manager here at Midshore Behavioral Health, and so glad to see everybody this afternoon.
So that is
that gets us.
Yep, that is our Midshore team. Just as a reminder, the service provider responses are due to us by January 17th. That allows us some time to review and get them into our application that's due on February 4th. And I did put the link in the chat to the page on our website where you can see the recording from the first pre-bid conference call, as well as the question follow-up that was posted. So with that, we are here for your support and to answer any questions. Oh, I'm sorry. Amy and Lorianne, did you guys want to do a quick hello from the CHRC?
I'll say hello. I think we know most of you all, but it's
Yeah.
nice to see you. We're excited for your interest, but a huge thanks to Midshore for all your work and for reaching out, inviting us to be part of this. We're just really excited about all the collaboration that's happening on the Midshore. Amy?
Hey everyone, I'm Amy Yakovlev. I'm the Deputy CFO of the CHRC, and ditto to what Lorianne said. I'm looking forward to being on this call and helping to support.
Thank you. So with that, we are ready to take any questions. Sean, I see your hand.
How you doing, Taylor? How you doing? Hey, quick question. I'm good. Hey, you said you sent out a budget template. I was searching my email, but I did not receive it. Saying we could send that again?
I sure can. It also, if you are on the list from the consortium, they also sent it out as well, but I will make sure to follow up and send that.
Okay, thank you.
I think I may need a private tutorial because when I looked at the form, I just went Google eyes, having no idea about how to come up with a budget or with anything else for an idea that I might have regarding eating disorders, some sort of a program. But anyway, that's about how vague I am about the idea, and even more vague about how to fill out the form. I don't want to take up your time because other people probably have specific questions, but I'm fairly overwhelmed, and I think I need to sit down with someone who's done this before.
So I'll respond to that real quickly, and we can sort of feel out this meeting if it makes sense for us for Amy, the expert, to go through the two templates. I will tell you, we the CHRC have another FAQ call coming up, our own second pre-bid call on the 15th. Now maybe that's too late for Midshore's timeline. We were planning to go through the budget template on the 15th. If that's helpful. But Taylor, did you say your internal deadline is what, the 17th?
Mm-hmm.
So I'll put that out there. To the group, or maybe this is more to Midshore. Would you like us to spend a couple minutes with I'll volunteer Amy to share her screen and give sort of the budget tutorial, or do we want to take some questions instead?
I think that could be beneficial. I know there was an overview of it the other day, but with it being new, I'm sure there's quite a few questions that people might have. So if you want to do a quick overview of it and go through it, that would be great. I think, Amy, you should be allowed to share a screen. If you can't, I do have the template pulled up on my screens as well. So if you can't share, just let me know.
Okay, great. Yes, I will try to share right now.
Thanks, Amy.
No problem. Let's see. Okay.
Catherine, thank you for volunteering to be peer support to Julie.
Okay, here we go. It looks like I am able to share. So if someone on the call could just let me know they are able to see the budget narrative right now on my screen.
Yes.
Yeah, I can see it.
Okay, perfect. Thank you. Okay. So yes, as Taylor mentioned, go ahead. I'm sorry. As Taylor mentioned, we did give a demo on this earlier this week. I will highlight on key points that we discussed, and we'll also go over to the actual budget template, which is that cell sheet that has to be completed as part of your budget process. I'm sharing the budget narrative though. This is the template that service providers that are applying under a hub and that are also just applying, separately, requesting funding from the CHRC will be completing and using. So we highly recommend the CHRC that all applicants reference this budget narrative template first as a starting point, because this budget template is meant to give specific guidelines around how to fill out the budget Excel template. We've really beefed this up to give more descriptive information. So I highly recommend focusing on this first. And in this document, again, it will give clear outline directions on how to fill out the Excel document. And then there's also other pieces of information that you need to complete in this narrative document. And again, it's clearly outlined in here. There are text boxes, as you can see as I'm scrolling down, where you will need to complete added information to the text boxes for each budget section. And there are also tables that we are requesting be completed as part of some of these budget sections. So again, always start with this budget narrative. It's giving guidelines around what is required. I will flip over to the Excel document because I do think that's probably what you want to see. So essentially our Excel template, we've tried to streamline it versus the prior template that was sent out back, a while ago. This is the new one that was blasted out. It's only one page. And essentially it's meant to show one column for each, service provider that's completing this to specify what does your overall total project look like, that cost. And then it's meant to say, okay, I know that, sure, I might have a total project cost of, let's make up a number, let's just say $1 million. But I have a potential for some of my positions, such as a therapist, to be able to bill, say Medicaid insurance, commercial insurance. So I would not be requesting funding for that revenue I'm able to recoup from those insurance companies. So I don't, because I want to make sure not to duplicate, the funding that I'm requesting, as well as the revenue I'm getting. So that's the reason we're requesting that you provide your overall total project cost. And again, you would start up here, and it's, again, patient program revenues, income collected. That's, for billable services. And then your other grant funding support, any other types of non-CHRC grants that you might have. If you have an in-kind organization match from your own organization, that would be, any other revenues. And then whatever you're requesting from the hub is what your funding request would be. And then when you total all of these, that's where you get your total project costs. Now, some folks, if they're not able to bill and they're not getting any other income, they don't have any in-kind, organization match. The amount being requested might actually be the exact same as the overall cost that you see in here. So it doesn't necessarily mean it's going to be different. But just wanted to kind of explain what that meant. And essentially, so for the example, if you have a program specific to, say, eating disorders, you would be very specific as to rolling this up high level position types, right? So if you have, say, a nurse practitioner position that is providing direct services under this specific grant, you would put, and say you had 2 part-time positions, you would just put that out one time. It would be called a nurse practitioner. And if that position, I'm assuming, could most likely bill, you would, figure out, estimate what would those revenue collections look like. I would need to back that out of whatever, that overall salary cost is. And if they're part-time, I clearly would have to reduce that a little bit further. Just an example. You might have some other position types providing services, let's just make this up, such as, say, a project manager or program director, that aren't able to bill and that aren't offset in any way. And that's where, those costs that you're showing here might be the exact same as your CHRC budget request. So salaries would be for, again, direct, so positions that are working directly on the grant. You can have indirect costs, which would be bucketed under indirect costs, because we know that there are other types of positions, that overhead, that have some type of impact but aren't directly working on that grant, such as, if you think about payroll, someone processing payroll reports, HR, if, positions being recruited for, accounting, things like that. So that would be lumped in, and I'll get down to that in a second, in your indirect cost rate. But essentially, you would be completing, again, total cost, and then what you're requesting from the hub. We call that CHRC budget request. Your fringe benefits, what that looks like. We say you can provide up to 25%. If you're requesting more than that, you have to give documentation for why you are requesting more for that. We have very specific categories outlined on this template. The only areas that you would be able to insert new rows would be personnel salary and contractual expenses. You would not be able to insert rows anywhere else. We want to try to standardize this across all the different service providers, so we have one like template. And if you have expenses that don't fall in any of these categories outlined here, you would be putting those under your other expenses. Other expenses is meant to be like a catch-all, such as, expenses associated with employee background checks, fingerprinting, participant incentives, etc. Total indirect costs, again, that you would want to speak with your hub specifically about this, Midshore, but the CHRC allows up to 15%. When we say indirect, meaning 15% of your direct costs. So anything above that line, you're able to charge that. The CHRC and the hub, again, we don't require documentation For indirect costs or fringe benefits, again, since you're working with your hub, your Midshore hub, you will want to just validate some of this stuff because I know this is going to be a little different this time around. We've added a new line item for marketing related expenses because we want that to be separate and that to be consistent across, all applications we're getting. But again, you will find all of this information much more detailed than what I'm saying on this call and that budget narrative document. I'll pause there because I know I was talking kind of quickly. I know we'll have other questions on this call to see if there are questions on that.
Amy, I sent a question yesterday about that bottom number, the very bottom of this report being
Okay.
over 100%. Does that sound right?
The very bottom number. Are you talking, Beth, this number here?
Yeah, the very bottom number. Why would that be higher than 100%?
It should not be higher. So I'm glad you brought that up, Beth. What this is doing is it's looking at what your overall CHRC funding amount is compared to what your overall total project cost is, right? Which should essentially match this number up here. So the way the calculations are, it shouldn't ever exceed 100%.
Can I give you an example so I can see why? Hold on, I just got to open it up.
Sure.
Just because it was over 100.
Okay.
Hold on. Oh, okay.
While you're pulling that up, something I'm glad you're asking this, Beth. You'll want to make sure when you are inputting what you're requesting from your hub, right? That funding, the CHRC grant funding, this spot here matches this all the way down at the bottom here, your totals. The same would go for your overall total project cost, which is a sum of your CHRC grant funding plus these three categories. If you do have any revenue that you are planning to obtain, this total project cost should match down to this total project cost at the bottom here.
Okay, now I'm ready. Okay. So if you put $1 million in the grant refunding, I just want to see how the example works out.
Sure, $1 million here.
Yeah, $1 million.
Okay.
And $1 million over in the other column too. Or I guess it doesn't do that there. I'm sorry, the second column is calculated. Then put 100,000 there as other revenue.
Mm-hmm.
And then let's say that the salaries, whatever, are 900,000.
Okay, just make something
900,000.
Okay.
Yeah.
Mm-hmm.
And maybe the second column is 850. And then let's say 25%.
Okay.
And then some, let's say equipment of 50,000.
Okay, well, this is where we'd have to adjust the numbers up here because
why, if you're asking for the funding?
Right. Because if you're asking only up here for $1 million in funding, you've already exceeded $1 million.
Oh, right. Okay,
here.
so we would have to adjust it. Maybe it's $1.5 million.
Exactly.
Okay, let's say it's $1.5 million.
So do you want to just match?
Yeah.
With here?
Yeah.
Is that where we want to end with? Okay,
that's good.
Got it. Okay.
Okay, so did it come up to 100% at the bottom?
And then this needs to be increased to, to match 1162. Let me just put something else in here to get to that in order to see. Okay, 37,000. I'll just put that here. So 1162, 1062. 1062, 1162. So you can see here, your grant funding is 91% because you're getting 9% of patient revenue. And then that totals to 100%. Yeah.
So are
that's
you
accurate.
saying that in the grant funding request under the revenues, we have to add in the items that are in the bottom part also?
This is your
Like-
total cost, right? So if you're saying my total cost is 1162, anything you're typing in this column B should total to 1162, because this is your
Okay.
overall total cost.
Okay.
And then
All right.
whatever you're requesting, from CHRC funding, it would be in this column C, and that should
Okay.
match what's there. Yep. No, good,
Okay.
great question.
Okay. I just wanted
That
to
was a
be
good way to
sure.
demo it.
Okay.
Sure. No, great question.
Okay. That helps a lot.
Yeah. No, thanks,
Uh-huh.
Beth.
Okay.
I believe, is it Nelene? You had your hand raised.
Yes, said it right. Good job.
Thank you.
I have a couple of questions. So I work for the Cook Center for Human Connection, and we're submitting several proposals with different jurisdictions to offer our services. In some of them, I see that they're asking for the 990 form and the W-9 form, but I didn't see that on your RFP. Am I correct in assuming we don't need to submit those?
I believe those would come after you've been selected and we do the contract. That's when we would gather that information from you.
Okay, excellent. And then in the RFP, it talks about separate jurisdictions. So our services, we are hoping to include all 4 of the counties in Midshore. And so how do we, right now I have the budget written, so it's overarching for the full project. Do you need separate budgets for each county? What works best?
So I had a similar question to Lorianne about that the other day. So Lorianne, do you have any follow-up on that?
I do. I was literally talking to Mark 5 seconds, which is why I stepped away from my computer 5 minutes ago. So this will be news for everyone, including Amy. Sorry, Amy. What we would like to see, if you are essentially doing a very similar program across 3 jurisdictions, just very similar services, everything's very similar. We're comfortable if you're able to consolidate that in a budget line. If you have clinicians perhaps that are a certain amount of FTE in a certain county, and this many in this county, this many in this county, we would like to see that level of detail. I think in that scenario, many of your other costs would be the same. So we wouldn't need to see that breakdown necessarily across the jurisdictions. Now, if you're doing 2 very different programs in 2 different jurisdictions, the CHRC would prefer to see 2 different budgets just so that we can really understand what's happening with those 2 programs. But again, following the lead of Midshore, if you all are comfortable, we are okay with a consolidated budget, service provider budget, but please provide some detail. This many clinicians in Dorchester, this many clinicians in Kent, et cetera. Does that work for I'm sorry, we're working this all out in the public forum here, but does that work on your end, Midshore?
So in the personnel salary, you're thinking it'll say therapist Dorchester County X amount of dollars, therapist Caroline County or Kent County X amount of dollars, and that's how it'll be. Okay.
That's what we would like to see.
Tim, does that, our finance man? He's on here somewhere. I want to make sure that is.
Yeah, I think that's fine. We'll have
Okay.
one contract with one budget, which makes sense.
Right.
It's just I don't know if there's any reason why we would need to see a little more clearly the actual cost per county. If that's I'm actually asking that question. If that's something that we think we might need to have.
So again, we wanted to from CHRC, we're open to what Midshore's needs are. If you're looking for more detail, we are happy with that too.
I'm just thinking it would be cleaner to have a budget for each of the counties that are being served. I just don't know if that's a necessity or not.
I think that's how we did it. We did a budget for each of the counties for the funding of CHRC. Would that be similar to how we did it before, Lorianne?
So I think it would be different than how we did it before. But again, now you're doing it through a hub, right?
Mhm.
So I think that there may be reasons that it might be different than we did before. But previously, we had service providers doing for each jurisdiction
Mhm.
separately.
So we are still doing them for each jurisdiction.
You will, right, you will, for everywhere else that's not Midshore, you're still doing individual budgets.
Right.
So can I ask a follow-up then? Do I understand correctly that if the services are similar in all 4 counties, it is acceptable to provide one budget, but it might be useful to show the breakdown on a separate, like when I say one budget, I mean one budget template. Do you want us to break it down by county on a separate form that we create, or do you want us to include that perhaps in the narrative? So if I say I need 200,000 for parent coaching, and then in the budget narrative, break it down 50 for this county, 50 for that, what's the best way to show that? If it's kind of overarching similar services to every district that we're proposing to work with.
Mm-hmm. And again, Midshore, if you want to weigh in first, please feel free.
Yeah, I'm just kind of thinking this through out loud, and I was going to say that maybe we want to hang back our Midshore team just for a few minutes when the call concludes, just to really talk this through a little bit more with what makes the most sense. But I'm almost thinking it would be nice to see it by the county.
Is that something that could be like one of the appendices that's added in the budget area? Like if they broke down by county, like just on this is how much per county as an appendix item, or like this CHRC budget per county. But that's something that we can talk about and then send a follow-up to the group on what the best course of action would be for that.
I have another question also. Just finishing trying to stop breathing. When we submitted the budgets last time, Lorianne, do you remember when anything that we had collapsed, you asked us to expand on to show you in another narrative? Are you not wanting that this time?
So in your budget, in your budget template will have a line, right, by each position type. And then in your budget narrative, that's where we are looking for that additional detail.
There is no space to put that.
So I think you can expand the space in the budget narrative.
Yeah.
In the one little box, only in the original text box, it only asks for how grant funding, how you're going to get some supplemental funding. It doesn't ask for that additional data. We have a separate document with that information on it. Are we available to submit that it's got the whole narrative on it? It has the way you all did it before. You didn't have all those little boxes, which you have in basically the same sections as we did before. There's no place to put that narrative of, unless it's the very first box, of the collapsed positions.
Amy, are you able to share your screen and show where that information might go?
Sure. Yes, Lorianne, I can do that. Just make this a little bigger again.
Sorry about that. I have Dr. Payton on the call. Dr. Payton, can I ask you a question, please?
Sure. While you all are working on the budget question, a follow up to that is I'm hearing that the budgets might be consolidated. I know we're going to wait. Midshore may get back to us. But what about the actual proposal? So if we're looking to put more than one county or provide services in more than one county, can we create the grant proposal response with multiple counties, or would you still want one per county?
In the first meeting, we discussed having just one proposal and listing that if you're going to have all the same services in each county, list the counties it's going to be in. If there's any difference between the counties, and then just have like a separate description on what the services or how the services would be different, or if it's a different program. So it can all be under one proposal.
Okay, perfect. Thank you.
Mm-hmm.
Okay. I think the part that we're going to stay on internally and talk through is just the budget piece. So stay tuned for something being published, hopefully today. Just, I want to make sure our team can get on the same page about what we think might make the most sense for this project, because this is a little different than some.
Okay, so Amy, you want it in that very bottom or at the top?
Yes. So this box here, you can actually put it here if you'd like.
Yeah.
This will expand, as you can see. So yes, you can enter that information there. Apologies if it was a little confusing. We've put so much into this template. But yes, you as soon as you start typing, this will expand as as far as you need it to.
Okay, so that's where we would put the additional narrative with regard to the salaries.
That's correct. Yes.
Okay.
Yep. Yep.
It just didn't make sense that it was there. So, okay, I can do that.
Yes, we've tried. Oh, sorry, Beth, really quick. We've tried to expand on this before. We didn't have this additional table, but we thought it'd be a little bit clearer to have a table there to outline what was needed. And in addition to that, clearly you can write a write-up on those position types.
Okay. Okay, I got it. Thank you.
Sure.
I have another question, but I don't want to take up all the time. And it's a little tricky. We are applying in several counties in Maryland, including a couple of others. And as we write in a grant manager, project manager, we assume that that person will work in all of these other areas if we're awarded, but we don't know, right, what will be awarded. And so we're trying to figure out, do we write in a position with a salary, or is it better to try to include, that part-time grant management as part of a contractual, like a contract employee, and then, or indirect costs? And maybe I can ask this later because it is a little bit complex and probably doesn't apply to the rest of the group. Do you understand what I'm asking?
So speaking,
maybe I'll
go ahead, Lori.
Go ahead.
Go ahead. No, go ahead. You go ahead.
So I will say, in the last round of grants, we had a number of organizations applying for multiple jurisdictions, and they said, hey, if we're awarded in these 6 jurisdictions, for example, our costs will go down, right? Or we'll be able to share staff. But if we're awarded in 3, how do we budget? And we really handled that through the grant modification process.
Okay.
So if I were up to you, I think we're agnostic on whether that person would be contractual. If it's indirect, you should put them in indirect. But if it's not, if it's a direct position, think about it for this grant, and then that's something that I would say that if and when we find that the same organization is awarded across multiple jurisdictions, we'll go back to you and say, okay, now are there economies of scale we should be finding? Or is there shared staff that we should be finding? And then you can redirect those funds in other ways.
Okay, thank you. That answers my question.
And just really quick add on to Lori, if you are budgeting this as a contractual, though, you really do need to make sure it's true contractual expense and it's not really a W-2 employee. That's an employee of your organization. So, because we've seen in the past, not specific to consortium maybe, but other grant programs where there's a mix up there, and where they don't account for fringe when they should have because they bucketed it wrong. So just make sure you're bucketing it in the right category.
Thank you.
Okay, Catherine, you're the next with your hand up.
Thank you. One of my questions is just mostly covered by that question about more than one county, but I just want to clarify, some of the decisions haven't been made yet, I understand, but as far as the decisions that have been made, if we've got 2 mid-shore counties in our proposal, I understand we can have one proposal. Can we have one budget narrative, and then we're just waiting to hear back on whether we can have one budget template? But is it definitely okay to collapse the information into one budget narrative where we might describe some detail about each county, or does that decision still need to be made as well?
So I'll defer to Midshore on that one.
Yeah, I was thinking that we should probably talk about how we want the budget submitted and how we want that breakout to look, if it's going to be broken at all, before that should probably be kind of one and the same, I think, as far as a narrative that goes along with those budgets, if that's okay.
Okay, when you provide us guidance, if you follow up later, just please let us know clearly, is it 2 budgets and 2 narratives or something other than that? I want to suggest also that for some of us, if we do need to break it down by county, and I'm hoping we don't, but if we do, having multiple columns on the same spreadsheet might be easier than having more than one spreadsheet, if that's possible, you know, county columns, because the overall project cost, it would be nice if maybe, I don't know if that has to be divided between counties, but if it didn't, if we could have one overall project cost and then break down the counties. Anyway, just a suggestion that the simpler you can make it, the more helpful it will be for us, the more we can get on one page. My other question was, just want to clarify exactly what we need to turn in by the 17th. So we need to turn in our proposal, our budget narrative, or multiple budgets, budget narratives, and our most recent M&D report and progress report, which I assume does not mean the one that's due February 1st, because it won't be February 1st yet. I assume it will mean the prior one. And is that everything we need to turn in by February 1st, or am I missing anything?
I think that's everything. Yeah, your February 1st, if your February 1st one is completed by then, you're welcome to include that one, but I understand realistically it will be the previous one that has been completed so far. That was in the CHRC budget or RFA, so we used the same verbiage for ours. So the most recent one, but everything else you listed, that is everything.
Okay. All right, great. And we can submit it all by email to you.
Yes.
Thank you.
I'll have some of them. I understand some of the files might be large, so I'll set up a box that they can be dropped into as well if they're too large to be emailed.
Great. Thank you.
Alan.
Thanks. Yeah, I got 2 questions. One for Midshore, just I didn't go to the other part of the meeting, so basically you would consider our proposals for us to become invited partners. Is that right?
You would be a partner with Midshore, as Midshore will be a full community support partnership. So you would be you'd be included in our proposal to the CHRC as a partner with us, yes.
Great. And so then you just look at the proposals and decide whether or not you want to include them, right? Oh,
There's a review committee that will make the decision that we will then include those with our proposal response, and then also we'll let everyone know those findings as well.
great. Second question, maybe for you, maybe Lorianne. So with this multiple counties, right? You cover 3 counties. So does that mean the budget guidelines are multiplied by 3, or is it just the one amount that covers the whole territory, the whole region?
Do you mean the budget guidelines that the CHRC provided?
Yeah, I mean, it's like I saw what 300 to 500K, something like that. Is that for each county, or is it total for Midshore's proposal, or for each of our proposals? I guess, yeah. What's the budget
Right.
guidelines for?
So the CHRC sort of intentionally doesn't create a floor or a ceiling. We want these to be really need-based budgets that are developed. I think we provided in the RFA what the average award was last year, just to give folks a frame of reference, but it really should be need-based. So we would encourage,
Okay.
frugality.
Okay, thanks.
I was muted. I see Nalene asked in the chat when you guys would hear back on the selection. Our Katie, you just sent the invite out today and I already forgot the date. So we will be reviewing them on January 23rd. So shortly after that is when we would be reaching out to everyone, I suppose. Is that correct, Katie? Yeah. So the 23rd is a Thursday. I would say by the 27th, you would probably know.
If we're selected to be in your proposal, does that mean that we're funded, or do we wait to hear what happens with your proposal to the CHRC?
That's a Lorianne question, I believe.
Yeah.
Well, we look forward to receiving Midshore's proposal that will include a number of service providers in it. And then we will look at Midshore's proposal along with the rest of the state. We'll look at the funding that we have available. And then if there are changes that we need to make, we'll go back to the Midshore team, and then they would communicate that to their service providers in their proposal.
Brianne?
Thanks, Taylor. It's probably also a Lorianne question, but just figured I'd ask. Do we need to submit an original bound copy of our proposal to the consortium if we were selected for Midshore? No. Okay.
No.
Great. Thanks.
No, I believe we have to submit one paper copy. And I guess I'll ask while I have you here, do you want us to include the proposals from the service providers in ours that we submit to you?
That sounds really massive. Let's
It
chat
does.
about let's chat about what documents we need and what documents we don't need from you all.
Okay. All right. We've got about 12 minutes remaining. I'm going to make sure everyone gets their budget questions out there while we have the assistants here with us today. So if you have any other budget questions or any other questions about the submission, we got a few minutes left. And as same as the last one, this recording will be posted on the Midshore website under the For Providers tab. So this will be available to reference back. And then the follow-up question or response about the budget, that response will also be posted on that same page. And I can send an email out as well about that.
I apologize for my long chat message. I thought it might be just simpler to put it in there.
I was just getting to reading it. If you want to go ahead and ask it, you're more than welcome to, since there wasn't any other questions at the moment.
It's just a suggestion. So I'll save the time for other people who have questions.
Okay.
Taylor, I have a quick question on the justification portion of the proposal. There's several sources that you can draw from to justify things as a local need. Are there preferred resources or of that list? Are there preferred resources? Like we've used the report card, we've used assessments or needs assessments from the community schools. We've used a couple from the LMB. So anyway, is one better than another when it comes to the justification research?
Nope, those are all the ones that we have suggested. They're all equally important and have lots of information in them. So if you're using all of them, that's wonderful. I think that is the most recent information as well. I mean, the report card is, I believe, last school year, and then most of the local LMB needs assessments were completed within the past 1 to 2 years. So that is the most recent, and that's what we've suggested. Yeah.
Okay, thanks.
I'm gonna stay on for the 9 minutes in case. Oh, Mindy, you have your hand raised.
Hi, thank you.
Mhm.
Just a question about how detailed you would like the breakdown for supplies, for instance, on the budget narrative. Do you want like, specific items with specific costs, or do you just want the total and then kind of a lump sum, like these are the examples of the types of things that we would purchase under, say, office supplies or educational supplies? How detailed should we get?
Mindy, I can speak from the CHRC, what we're requesting. I know you will also consult with Midshore here, but in the narrative, it does provide specific guidelines to provide listing out your supply types along with the cost associated with that. Because on the template, as you know, we're trying to simplify it and just have you put your total. So I would expect, say you have office supplies, you have lab supplies, art supplies, and just making all of these things up. You would essentially do it just like that, a lump sum total, all supplies on the Excel document. Then in the Word document, you would list out art supplies, art and therapeutic supplies, X dollars, office and equipment, whatever that is, this much, and so on.
Okay. That's kind of what I thought, but I wanted to just make sure. Thank you.
Sure.
Tim, did you have anything to add to that for what we will or what you will need?
No, I was actually going to ask Amy or Lorianda because I was kind of curious their expectations are really because we're kind of reporting up to them, so it's usually a good idea to get their expectations, their requirements.
Don't fall asleep. You look tired.
Well,
All right, there are a few more minutes left. As a reminder, this is your opportunity to answer questions, or I'm sorry, to ask questions. Catherine?
I guess I'll go. So this is a vague question, which is why I wasn't going to ask it, but is there any guidance you'd like to give us regarding the overall project cost and what to include in it? And by that, what I mean is, so the definition of unduplicated students was expanded after the beginning of the, after we submitted our last proposal. And so, for example, there may be students who we're serving that count as unduplicated students, but for whom we don't really need additional grant funding. So to continue serving those students, should we include them in the overall project cost and then show that we have enough revenue to cover those services entirely? Or, because you maybe want to see the all of the school-based services that we're providing, even if we're not, does that make sense? Or if it's sort of part of the same program, right? Part of the same effort, right? But part of the same work we're doing, but doesn't actually need grant funding for that part. I don't know if that makes sense. Let me give a more concrete example. So if we create a new position under the grant for a clinician to go into the schools and see students, we're going to need some grant funding for that. But if we have clinicians who just got a little bit of training under our last grant or under the next, we'll say in this case under the next grant, they just get a little training, but they already work for us. We already know how we're paying them. The services will be enhanced by the training that they received. we don't need a bunch of extra money to fund those services. Would you rather see them counted as part of our overall project, or would you rather us just exclude that from our overall project costs?
Thanks. Whew. In terms of counting the students, we want to count the students whose services have been enhanced through the grant. And so to the extent that you have a clinician who receives training in a specific EBP and then delivers that EBP to the students, and then I would say continues to participate in our EBP implementation support, we would consider that a student that is served through the grant. So in your M&Ds, we would count that student as being served. Should that person be included in your budget? Well, you said you're not going to seek budgetary support, but you could for their training time and their EBP implementation time, but you're not going to seek that in your budget.
Or maybe we're only going to seek, a very small amount of funding for the training. The vast majority of the funding to support those services would be from revenues we already receive. Right. Do you want to see all? Yeah. Do you want to see the big picture?
We're supporting a lot of partial FTEs under this grant just for that reason. That most of what they do is supported in other ways, but the grant is enhancing and augmenting the services. So I would I suppose include that person in my budget. If they're, and again, it could be a small portion of their FTE, but if they're part of this project and they're really training and implementing those consortium EBPs, I think we would like to see that.
Okay.
Again, this is the CHRC perspective. Midshore, please feel free to weigh in if you have a different thought there.
You have a question kind of similar, which is if we are supporting tier 1 universal interventions, does the entire population then get counted?
So then the entire population, yes,
cool.
is the student served.
Thanks.
Maybe I should take a step back. So there's kind of two maybe sub buckets within that tier 1. Tier 1 are services that are available to all kids regardless of need. There are tier 1 services that are delivered universally, like, for example, a mental health assembly that all the kids in the school have to go to, or health class curriculum that all the kids have to do. There are also tier 1 services that kids or families kind of opt into. So we call that opt-in tier 1. And some of these apps, some of these other apps that we're working with, and a number of other programs are tier 1, but really it's just the people who are opting into them. So if you're an opt-in tier 1, we would not want you to count the whole student population. Yes, it's available to them, but who's actually going to use it? That is the number that we would want you to use if you're in that kind of a situation. Does that help?
Got it. Just to make a joke, it wouldn't count the opting out as participation.
Correct. What's okay. Right? If someone has to actively opt into your program, then yes. Then
okay, I got it. But thank you.
That
makes it clear. Thanks.
Yeah.
On that same note, I think in our proposal last year, we listed every student as a potential unduplicated student, even with these opt-in programs. So on this proposal, we're trying to set sort of reasonable goals. That we can shoot for those that opt in, but we're kind of worried that, well, maybe those numbers look too small, even though I think they're reasonable and realistic. But so I don't know, does that help to have those sort of
it is better to have realistic goals
listed? Yeah.
It is better to have realistic goals. Yeah. So I apologize. I actually have a quick 3 o'clock call, but to the Midshore team, I'll be available shortly after that if we wanted to talk some more.
Thank you so much for being available, Lorianne and Amy. I really appreciate it.
Again, we really appreciate all you're doing, and we really appreciate the partnership.
Yep.
Right.
Thanks, everyone.
Thanks, everyone. Have a great weekend.
Thank you.
Thank you.
Brianne, I put the link to what you were asking for in the chat if you're still on here. I think she got off, so I will send it to her. Other than that, have a good afternoon, and the recording will be posted hopefully by tomorrow morning.